I'm Dr. Pascal Wilson. I am an oncologist and hematologist with Family Cancer Center. I work at our Oxford, Mississippi location. Well, there's more than one way by which cancer can cause a person to have pain, and not everyone with cancer will have pain. Many patients, in fact, who have a cancer diagnosis never have problems with pain from their cancer. However, cancer that spreads or is causing damage to nearby organs can cause direct pain, such as when cancer moves to a bone. And it's also possible for cancer to cause pain indirectly, say when a bone has already been damaged by cancer and then the bone gives way even though we've treated the cancer successfully. Pain medicines can commonly cause sedation and can also commonly cause the bowel movements to slow down. For a patient who develops constipation after taking pain meds, that doesn't mean we have to stop their pain medicine, simply that we need to keep them on a medicine to keep the bowels moving effectively. In regard to sedation, that also does not mean we have to stop the pain medicine, because many times sedation will wear off once a person has taken a pain medicine for several days. If necessary, we can use other medicines to offset the effects of sedation if we have to. Well, sometimes finding the right pain medication for a patient can be a process of trial and error. We have a large number of medicines to pick from, and what works well for one patient may not be the best choice for the next patient. Typically, we'll start with a short-acting medicine. If we find that a patient with cancer pain needs very frequent doses or doses around the clock of that short-acting medicine, then we'll add in a type of long-acting medicine so that they don't have to take a tablet over and over throughout the day or wake up at night to take an extra dose of tablet. But generally, we can get that balance adjusted so that their pain is controlled with infrequent dosing of pain meds. In cancer patients, we have less of a concern about addiction risks. There have actually been studies that look at this and tell us that patients who have the kind of severe pain that can sometimes happen with cancer are just less likely to be addicted. We are careful about these medicines. Patients will typically get them in limited amounts and with careful monitoring through the office. But as long as we're using those in the right way and only using meds when necessary to control pain, we really don't expect most of our cancer patients to develop addictive behaviors. Pain management is an important part of our practice of cancer medicine, and patients will find that they will often be asked by the nurse doing check-in about their pain as part of the vital assessment that's done each time the person comes to the office. We want patients to be straightforward with the nurse collecting that information, and the doc will look at that and keep track of that from one visit to the next to see how well we're doing to control pain. There is not a reason for a patient to hurt unnecessarily in the setting of a cancer diagnosis. We have good things we can do these days to control pain, and we want to keep pain under control.